Hey everyone, real talk. This week I was studying some of the drugs that are used in the treatment of Alzheimer's, help to slow the progression of Alzheimer's. So they're monoclonal antibodies, and these are patent, these are billion-dollar industries here. So these drugs are used to slow the progression of Alzheimer's disease in people who have Alzheimer's disease. The warnings are insane on these drugs, right? Do they work? Maybe, but the risk factors, and they don't work to the extent of what bioidentical hormones will work. So with one of these drugs, the label says they have to have an MRI every 2 to 3 months because you have to ensure there's not an emergency situation going on in the brain where the amyloid plaques are about to rupture or they're worsening. So you have to look for any emergent changes on a brain MRI because of this drug. But it's supposed to help you, but there's this huge risk factor. And one of the biggest takeaways for me is on the same drug label, it says patients with the genetic APOE gene, which we test here at Nova Wellness and Prevention. This is the Alzheimer's gene, and you have two variants. You have either a 3-3 or a 3-4 or a 4-4 or a 2-4 or a 2-2. There's 2, 3, and 4. Those are the variants of this gene. But anyone that even has one copy of a 4 is at risk for Alzheimer's. And on this drug label, it says specifically, patients should be checked for the APOE gene. If they carry a 4 in that genetic sequence, they are at more risk of adverse effects from this drug. So they would be more likely to have an adverse event from that drug if they have the APOE gene 4. Who has that gene? A lot of Alzheimer's patients have that gene. That's the Alzheimer's gene. So the drug that's supposed to reverse or prevent the progression of this terrible disease, Alzheimer's, the drug that's supposed to do this, the patients that are more likely that have this gene, the APOE4, are at higher risk of adverse events. I don't know how this makes sense. Politics and economics is how it makes sense to the people that make the drugs. I practice bioidentical hormone replacement therapy. I prevent Alzheimer's, prevent dementia, and try to reverse these things with the right optimized treatment that does not involve those warning labels. No brainer. Have a good day.